Welcome back on your Monday. Let's dive right into the deep end now. The Washington State Hospital Association released results from the 2023 financial survey of state hospitals and found hospitals across the state lost $1.74 billion that year.
Fortunately, hospitals should see some relief with the Safety Net Assessment Program. Joining us to continue the conversation this morning is Cassie Sauer, the CEO of the Washington State Hospital Association. Good morning to you, Cassie.
Good morning.
Thanks for joining us. So first, tell us, why are state hospitals losing such a significant amount of money? Is this still part of the aftermath of the COVID-19 pandemic?
There's multiple reasons for it, but one of it is the aftermath of the pandemic, and we see a lot of delayed care. So people who couldn't get the care that they needed in the pandemic, and so now there's more demand for that care, and they might be sicker than they would have been before. But some other really big reasons that are in fact pandemic related. One is that we are having a really difficult time getting patients out of the hospital once they've completed their care. So they, you need hospital care for an acute situation, but then we can't find a place for them to go when they're done with the hospital care. They can't get home care. They can't get into a nursing home. They can't get into a rehab hospital. So those are really challenging. And then we've just seen cost increases. You've probably seen the news about higher wages for nurses, for example, across the state, really expensive. And all that doesn't match up with the payments, especially for the Medicaid program, which is our state's program for low-income people, and it pays well below the cost of care.
Cassie, despite the significant losses that we saw last year, it still wasn't as deep as what we saw in 2022. And I believe that's when state hospitals saw $2.1 billion in operating losses. And last year, we're talking 1.74. So what is the largest expense for hospitals, and what changes were made to maybe cut back on some of those operating costs to try to lower that number?
Yeah, I think a lot of the pandemic-related costs that hospitals incurred that were sort of extra, running vaccination clinics and the really high cost of supplies. If you recall how expensive, for example, a mask was during the pandemic, those things helped. But hospitals have also made cuts and some cuts that aren't welcome to their communities. They've cut labor and delivery services. They've cut mental health services, cut beds in their hospitals. It's harder to get care. If you or anyone else is trying to get in for a surgery, for example, it can just take a lot longer. My son actually needs a surgery as a ruptured tympanic membrane. It's taken me months to get it scheduled, and I know how the system works.
Oh my goodness. Well, we are certainly thinking of your son. Hopefully you can get that scheduled soon. Yeah. Okay, well, it sounds like there is some relief coming. This Safety Net Assessment Program, how does it work, and how will it offer that relief that our hospitals need?
Yeah, it's an increase in Medicaid payments, and it's actually a matching program through the federal government. Hospitals actually put up the money, and then the federal government matches the money, and it goes back into payment for Medicaid services for patients all across the state. We are awaiting approval from the Centers for Medicare and Medicaid Services, working with our state healthcare authority, really urging both to move as fast as possible on this, because it was passed by the legislature in 2023, and so we're still waiting for the money to flow, and a lot of hospitals are counting on it and really banking on it happening.
When the reported losses for 2023 were made public, I believe you said in a statement that harmful regulations and restrictions can take a toll on state hospitals and then impact a system that's already financially vulnerable. What are some of those regulations and restrictions that you were referring to, and what type of impact do they have?
Yeah, one we've been really concerned about recently is a new interpretation by our State Department of Health that says in the past, hospitals had to provide what's called charity care, which is free or discounted care, to anyone who came to their doors for an emergency situation, and then they could restrict it geographically for people who are coming for an elective service like a knee replacement. The Department of Health recently revised after 3 decades of saying that, revised its interpretation and said that hospitals have to provide free or discounted care to anyone from anywhere in the world for any service. So people can come here to receive care for free for a transplant, a knee replacement, a heart valve replacement. It can be really expensive services, and hospitals have to eat the cost. So that's a very concrete example of something that's straining our hospital system.
Cassie, we've been talking about a lot of numbers over the past couple of minutes, and I'm wondering if somebody has to go to a hospital, or if they're trying to schedule a surgery like you had mentioned with your own son. Should people be worried about these huge losses that we're talking about?
People should be worried about it. Actually, they should. I suspect that probably all of your viewers who have needed to get a health service have had to wait or go someplace else or figure out some other way to get it. We've got what we call rural maternity care deserts right now. We have parts of the state where there's no one providing rural maternity care. It's very expensive to provide maternity care. You have to have a doctor, anesthesiologist, surgeon, pediatrician, crash team available, and they just can't staff them at the. And if you're almost exclusively a Medicaid hospital, they pay so little that it's just impossible to keep it open. So I think people should be really concerned about this, and I hope that people will speak up to their policymakers and ask them what they're doing to support their hospitals.
I was going to say, is there anything that people at home can do?
Yeah, I mean, I think that's it, is to be inquiring of their legislators, what are both state and federal, what are your plans to make sure that the hospital system is stable? It got so destabilized during COVID, and we need help getting out of it.
Call your local policymakers. Thank you so much, Cassie, for that. And I'm glad you asked that question. So now people know they should be concerned about this and definitely aware. Thank you so much for coming on.
Thank you so much for having me. Have a great day.
You too. You think about the hit that our hospital system has taken, since the pandemic.